Hi, my name is Stephen Cohen, and I'm a hematologist, oncologist, and I've been in practice since 1975. And in the last 6 months, I've been moving my practice to a less intense but very valuable type of practice, trying to help people lose weight. So I have been extremely busy taking care of sick people for decades, and now I am moving into something less intense, but still a large problem in America, and hopefully we can help just a bit to improve the lives of people. So we have started this California weight management program about 6 months ago, and we've had a lot of success, and we hope to continue to do this. We got training in the program. It was very well outlined, and we visited for a number of days trying to learn about the program, and once we instituted it, we're kind of monitoring our results, and we're seeing amazing results in terms of patients losing weight, patients' attitudes improved dramatically as their weight drops. They feel better. They are, in many instances, using less medications for their blood pressure or their diabetes. Their attitudes are much better. Initially, some patients, if they're not successful, want to blame the program, but if they really apply the dietary principles, and they fall into line, and they do very well, and they recognize that their success really is dependent on their full participation. The program is effective really because the dietary principles work, and it's really not nuclear science. You eat fewer calories, you're going to lose weight. The hard part is to get people to buy into it, and it's very, very hard to actually continue all the principles of withholding the good stuff that they like to eat and have been for 30, 40, 50, 60 years, whatever their age group is. And they wouldn't be needing the diet if they could actually resist eating the wrong things. So it takes a re-education, and we help support them every week, and it seems to be working very nicely. And overwhelmingly, the patients are losing weight, and there's an occasional patient who is not successful. They're just not ready to lose the weight. It's that simple. In the first visit, I do what we call a complete history and physical, so I know what medical illnesses they have, what medicines they're taking, what allergies they have, what basically their history is. And I would consider all elements in whether or not they're good candidates for a vigorous weight loss program like this, and whether they have already health care. And we have to be able to think about what's going to happen with their medications as they lose weight. They're going to need less intense therapy for diabetes or hypertension or hyperlipidemia. They may even need to be on therapy in the future if I see their cholesterol, for instance, is completely out of whack. So we give them an overall assessment, and then I see them a second time in the very near future to reevaluate what our findings were in the laboratory and their electrocardiogram, and see how they did on their first week or weeks of management. As we get started, see if there's any alterations that need to be. Sometimes patients need appetite suppressants, and so we try to help them with that so they can be successful. At least 50% who've had really significant weight loss life-changing weight loss, metabolic changing weight loss for blood pressure and cholesterol and diabetes. I mean, very significant changes. And a tremendous change I see even in people who have not lost a lot of weight in their demeanor. They're amazingly happy. As I said, I've been a hematologist and oncologist, so I know about serious disease and serious emotional impact of one's illness. But I got to tell you, even in patients who've done great from their malignancy, I see incredible attitude changes from these people. They're really happy. Their self-image is better, and their physical stamina is better. It changes their lives significantly. As an internal medicine doctor, I can tell you that obesity has devastating effects. There's something we call the metabolic syndrome, where people get hypertension, diabetes, and hyperlipidemia, which is abnormal cholesterol, etc. And it affects people in every way imaginable. Orthopedically, they run out of knees, especially women. In the time they get in their mid-40s, their knees are shot, they can't walk. Their hips, another problem. All those diseases increase the cardiovascular risks. In terms of cancer, I don't think there's any cancer that doesn't have an associated risk with obesity. And a lot of very significant relationships: breast cancer, colon cancer, prostate cancer, all of these are related somewhat to obesity. And in fact, as an oncologist, I can tell you that every oncologic disease that's associated with obesity, those patients do very poorly if they don't lose weight. And if they lose weight, their survival is better. When we first started with California Weight Management, they sent me 5 big books of stuff with all kinds of data about diet programs and cholesterol and lipids and obesity, and it was very interesting. I read all of it, and I've actually been pretty well versed on the subject. I have a website that's called standardofcare.com, and it has an enormous amount of information about obesity and diets and all kinds of things about lipids and diabetes. And so I've always followed that and have a lot of information actually to begin with about all of this. And I've always been interested in trying to get my obese patients to lose weight. And until we put them on this diet program, I've been uniformly previously not successful. When they first came here for our training, I asked them specifically, because the diet is quite prohibitive. I mean, it goes down to like 700 calories a day. For people who are taking 3,000 calories a day to go down to 700 calories a day, I thought there'd be some adverse effects, but we really haven't seen it. Now, we have seen some people said they didn't feel so good the first week or two, but nothing really that was unsafe. There was no manifestations of anything really that they could point to or that we could find. And that usually passes, and then the patients feel much better with the program. I would say that about 70 to 80% of the patients we see do already have medical complications. And those would be the diseases we already mentioned: the diabetes, the hypertension, the hyperlipidemia. So yes, and I'm actually surprised when I see somebody who's not on medications and doesn't have a disease. But even those patients, we discover, well, they do have something. They do have hyperlipidemia. Many of them have mild hypertension that they didn't know about. And they also frequently will have, when their lipid studies come back, have high cholesterol and stuff, that we then either address directly or wait for the diet to help.